Hundreds of nursing homes are now under fire after a pair of senators released a secret list of facilities facing ongoing health problems. Thank you for joining us tonight at 7. I'm Colleen Marshall. The two Pennsylvania lawmakers released that list of nearly 400 nursing homes, a list that was previously kept under wraps earlier today. These are facilities that the U.S. Department of Health and Human Services took issues with for health, for safety, or sanitary reasons. Nearly 24 of those nursing homes are here in Ohio. 5 of those flagged as special focus facilities, which the department says have more problems, more serious problems, and a pattern of problems over a long period of time than is typical for nursing homes. 2 of the most serious cases are in central Ohio, Uptown Westerville Healthcare and Isabel Ridgeway Post-Acute Care Campus here in Columbus. 6 others are considered candidates for that more serious group. 2 of those are in Columbus, Scioto Point and Whetstone Gardens and Care Center. That last one you might recognize. A lawsuit was filed against the facility back in February after a man died of septic shock while in the care of the nursing home, sparking claims of patient neglect. The other 4 nursing homes listed are outside of Columbus, including the Laurels of Hilliard, Columbus Colony Elderly Care in Westerville, Logan Care and Rehabilitation, and Newark Care and Rehabilitation. Today's release does not make clear the reasons why these 8 Central Ohio nursing homes are also on that list. The national report was conducted by the Center for Medicare and Medicaid Services. Our Washington correspondent, Morgan Wright, tells us how the bipartisan senators took it upon themselves to release the names of the poorly performing nursing homes to the public, even when CMS would not.
Pennsylvania Senators Democrat Bob Casey and Republican Patrick Toomey say when a family or individual decides to place their loved one in a nursing home, it can be difficult.
This is a critical, sometimes life-altering decision.
They absolutely deserve to have the information about the quality of care their loved one is going to get.
The Center for Medicare and Medicaid Services is in charge of a special monitoring program for nursing homes that have serious health and safety violations. The report reveals nearly 400 nursing homes are underperforming across the country, and the Centers for Medicare and Medicaid kept that hidden from the public.
We were disturbed to learn that there was a whole category of nursing homes across America, including some in Pennsylvania, that did not meet the normal standards of care and quality, and yet they were, their names were being withheld.
Senator Toomey says fewer than 100 of them are participating in a special monitoring program.
Those are disclosed, but the only reason that the other 400 are not in that program is because there's not enough manpower.
CMS told the senators federal budget reductions just don't give them enough resources to properly report.
They need more money, I'll support it. I'm in the whatever dollar amount it takes category to fix this problem.
The lawmakers hope this study will lead to improved nursing home care and help consumers make informed decisions about which facility they choose. In Washington, Morgan Wright.
So what does today's announcement mean for people who have loved ones in these troubled facilities, and what things should be considered if you are looking for an extended care facility? Joining us tonight to go in depth on this issue is Bev Laubert, the state long-term care ombudsman with the Ohio Department of Aging. So were you aware that this list existed of these troubled facilities, including that many here in Ohio?
We were aware that there was a list, and we have wanted the list, but we haven't been able to get it. So we're actually, as advocates, very happy to have this information out.
So you knew about it, you couldn't get it. Were you trying to get it? What was the reason that these federal health officials would keep it secret?
We have asked for it. We don't really understand why it was kept secret, because more information for consumers is good.
So is this important, knowing what's on that list and why they're on the list?
It is, because when people are looking for a long-term care facility, they need all the information that's available to them. And we can go through the health department survey reports, but it doesn't really give us a good picture of, it's difficult to kind of figure out, well, they've had 3 bad surveys, they might be subject to this special focus list in the future. It's just a guessing game until now.
Now, as this ombudsman, do you consider your role and the state's role in being an advocate for consumers? And how should people connect with you to find out the steps to take?
Yeah, so the Office of the State Ombudsman in Ohio, we have 12 regional ombudsman programs, and here in Central Ohio, our programs operated by Easter Seals. Somebody can call us, we can talk about complaints we've received, we can talk about the facilities on that list now and what that means to them, and the facilities that are on the special focus list, the 5 that are on there, are facilities that are at risk. If they don't improve care, they could be closed, like Uptown Westerville.
Okay, so this list has been secret until today.
Correct.
But were you aware that there might be problems with these facilities that you now see on this list? I mean, was this a shocking surprise to you?
The facilities on the list are not surprises to us, but we didn't know that they would be close enough to be added to the special focus list.
So what happens now? Now that you are aware that those facilities are on this special focus list, that they might have sanitation or care or some other kind of a problem that brought them to this level of focus by the Medicare system, what do you do? Do you connect with them? Do you start monitoring them more carefully?
Yes, I think that we will have our ombudsman in there more often, checking in with residents, finding out what's going on, and there are resources available so we can be proactive and give those nursing homes some ideas, some things that they can do to correct the problems.
What about families with loved ones there?
They should ask a lot of questions. They should think about what are the problems that are, look at survey reports. Are these kinds of things that might affect my parent or my aunt or my family member? And then ask more questions about what they're going to do to fix the problems and reach out to the ombudsman, and we can help mediate some issues, give some suggestions.
All right, Bev, thank you so much for being with us.
Thank you very much.
We appreciate it, and we're glad that list is in your hands now.
Yes, absolutely. Thank you very much.
And we're going to continue to keep a close eye on these nursing homes and on this list and other ones where problems might be occurring. You can follow us on air and online at NBC4i.com. We will continue to have the very latest.